there's anything that I want people to learn from this event tonight is that they should take care of themselves as well and not neglect their health care, their mental health, their physical health, and of course their emotional health. And laughter is one of those parts of emotional health. So you have to find a way to keep the humor in your life one way or another. I can tell you that when I look at the patients that I've taken care of over the last 36 years, the ones who have aged the best are the ones who've maintained their sense of humor, whether it's someone I'm watching for a long-term prostate cancer management or just for long-term urologic care. Those people who still can either laugh at themselves or be able to laugh at others as they laugh at themselves are the ones who seem to do the best, and they seem to have the best relationships with their spouses or friends or children as well as a result of the humor that they share with others. And it's really been fantastic that they do that. So we're really going to be wrapping up in a few minutes, and I just wanted to know if Kathleen, if you wanted to have a last few thoughts that you wanted to share with those that are watching, whether it be for support network opportunities or things that they can do to reach out if they need resources to reach out.
So I'm going to just speak to the caregiver and say how important it is that every day that you think about doing something for yourself, a walk. Right now, we're giving all of our caregivers at our center massages for the next 2 months. They can go and get a complimentary massage if that's something you enjoy. Doing something fun, like you said, doing something you're passionate about as a caregiver. Don't forget your hobbies and interests. And I know caregiving can be overwhelming, and it can be overwhelming taking people to appointments and you're worried and you're stressed out. But just remember what you used to enjoy and take pleasure in, and add some new things that you might never have thought about it. We have a wonderful music therapy group over Zoom, and we have a lot of caregivers in all of our programs, and they're welcome to there are only a few things, like we'll have a cancer group that just is for patients, but almost all of our other programs are open for caregivers. And you don't have to be with Carmenis. You can be any caregiver in the community that's taking care of a cancer patient in your family. I really believe that as caregivers, we need to support each other, be there for each other, acknowledge our own needs, like Julie said, ask ourselves, how am I doing? And give ourselves permission to develop our own army of support. The patient does have a lot of support, but sometimes nobody says to the caregiver, how are you doing? And the caregiver doesn't say to themselves, how am I doing? Like Julie said, that's really important. So.
And Julie, do you have a few final thoughts that you'd like to share?
I do. I kind of wanted to circle back to the compassion fatigue for a second, because one of the things, and Kathleen again mentioned it when she's talked about her dad going through all the different emotions, but for caregivers, when we get compassion fatigue, sometimes we're also angry, like we're fed up. Fatigue, I'm tired, and maybe I need to rest. Maybe I need to take a nap or soak in a bath or something. But also I might be angry. I might be tired of it, like I'm fed up. And I think it's important to have a space to allow yourself to be angry. And here's where doing it on paper, and if y'all have seen me do it, you would also have humor because it's downright hilarious, because I physically act out my anger alone. And after I laugh hysterically. So it's kind of a win-win. But I think important for the fatigue part is it's so hard for people to allow themselves to be angry, because I think that somehow they think that it's wrong to be angry, or that being angry means that they're not grateful for, all sorts of different things. And I just think, anger is a powerful force, and it can take you to your strength. But we spend so much time trying to suppress it. And it's just really important to have safe places to express it without having to hold back, knowing that you're doing this just to allow yourself to get this out. You're not trying to hurt anybody or harm anybody. You're doing it in a safe, responsible way, but you're doing it. And so I wanted to add that to the compassion fatigue part, because I think it goes in there somehow. So that's all I wanted to add.
Well, that's
Right.
being compassionate. So
Okay.
thank you. Well, I really do want to thank both of you for being here tonight. Julie Booksh and Kathleen Hardy, you really made tonight special. Covering topics that are beyond my skill set. Remember, I am just a simple urologist.